So this is a video of how to use the life-saving naloxone, nasal naloxone kit. So when you approach a patient that you suspect might be having an opioid overdose, okay, and you have your handy naloxone kit, the most important thing is to assess the patient first to see what's happening in the situation. Make sure it's safe for you to approach. Okay. If you forget any of the steps that we'll go through today inside the kit, there is an instructional pamphlet here about the Save Me steps to respond to an emergency. So first, S stands for stimulate. Approach the person and try to get a response. Either call their name or use your gloved hands to stimulate the shoulders. Okay. Grab their shoulders, squeeze the muscles, see if they'll respond to you. If they don't, okay, next step is A, check their airway. Okay. Lay the patient on the ground if they're not already and check their airway by the chin tilt head lift. Make sure there's no objects obstructing their airway inside the mouth. If there is, remove them. Okay. Third step, we want to check their breathing to see if they are actually breathing. Okay. You want to put your ear right to their mouth, okay, and turn towards their chest. And take your time to observe whether their chest is lifting. Okay. That'll tell you whether they're breathing or not. If they are breathing, count how many breaths they're taking, how many seconds it takes them to take one breath. E stands for evaluate. That's what we're doing with the airway. If you find that the patient's either not breathing, okay, or breathing very slowly, less than one breath every 5 seconds, then it may be time to administer a naloxone. Make sure you put your gloves on for this. The naloxone nasal spray, there are 2 per kit. Okay. It might be possible for you to need more than 1 dose. Okay. Each dose lasts anywhere from 30 minutes to 120 minutes. Okay. And so it's a temporary rescue. So when you're ready to use it, okay, 2 fingers on the top and the thumb on the bottom for actuating. Okay. Put it right inside the nose, okay, with your fingers touching their nostril. Okay, and spray right inside the nose. Okay, one nasal spray is 1 dose. Okay. After you've sprayed it, the nasal spray works within 2 to 5 minutes. Okay, so observe their response and their breathing. If their breathing responds, that means they were in an opioid overdose and you've helped them. In the next 30 to 120 minutes, you want to observe them, make sure their breathing continues to remain normal, and if not, then you can administer a second dose, go through the whole Save Me process again. Okay. Within this time, you want to make sure you've called 911 okay, for emergency response. Okay. You want to make sure that you're also ventilating. Inside the kit, there is a face mask with a one-way valve. Okay, to help give rescue breaths and chest compressions